Hello, I just want to do a quick vlog reflection on the robotic laparoscopic myomectomy I had 8 days ago. So, if you are new to my channel, hi. My channel normally has to do with gaming. Glad you're here. Probably aren't going to stay. That's okay. If you are normally here for my channel, this is not a gaming video. This is just a reflection upon what my myomectomy was, and this might not be the video for you. So feel free to skip. So what is a myomectomy? In simple terms, it is removal of fibroids from the uterus. I had a robotic laparoscopic myomectomy 8 days ago, and this was also combined with a hysteroscopic myomectomy because I had fibroids inside the uterus as well. I had multiple fibroids, the largest of which was a little over 8 centimeters, which in fruit terms is about the size of a mango, and this made my uterus measure at about the size of a 20 to 22 week pregnancy. My surgery was scheduled for 5 hours. My surgeon removed a total of 9 fibroids, but he did leave one in because it was very deep and small, and by that he meant 2 centimeters, and wasn't really affecting anything, so he felt it was better just to leave it in than to try and dig it out. The timeline from my MRI to the actual surgery was a little over 5 months. Now, that could have been shorter by a month, but I chose to do an additional month because that way I literally wouldn't be having surgery on my birthday. I was given the choice of 2 dates, and I remember telling the scheduling lady, like, I am not having surgery on my birthday. I am going to be on a beach in Hawaii, which is totally true. See here. So while fibroids are very common, not all gynecologists actually know how to remove them well. I actually saw a total of 3 gynecologists, one of which refused to do any surgery at all, and one would only do open surgery, and that was what I was trying to avoid. The third gynecologist I saw was a specialist in minimally invasive surgery, which was interesting because the first guy was also a minimally invasive surgeon. So just because they say they're minimally invasive doesn't necessarily mean they'll do that with fibroids. But the third gynecologist I saw had a significant amount of experience working with fibroids. And here in Colorado, he was also on our 5280 magazine list of gynecologists. But for those who are maybe trying to find a surgeon who can do this, I would recommend starting with gynecologists who specialize in minimally invasive surgery, who also have experience with fibroids, and that's the part that might take a lot to work with. So it is a lot of calling and asking if that's something that they're able to work with. But one of the things I would recommend is starting with any doctors who are affiliated with the medical school in your area, and or looking at doctors who have MIGS, which is minimally invasive gynecological surgery accreditations. And those would be a pretty good starting point, and they might be able to refer you to somebody else who can do it. My largest fibroid was pretty big at 8 to 9 centimeters, which is why that first gynecologist I had talked to wanted to do it open, but mine was like, I don't know why others aren't willing to do something like this laparoscopically, but it's totally doable. So just know that you can do larger fibroids laparoscopically. So to step back a little bit, how I found out I had this. So I've always had incredibly awful heavy periods as I was a teenager until now. That was always dismissed as normal for me. Some women just have really heavy, really crampy periods. And because of that, I wound up incredibly anemic. I had a hemoglobin of less than 10. My ferritin was about 4. But the biggest sign was I felt a very hard mass in my abdomen. I didn't know what it was. I felt it was growing bigger, but at the same time, I was losing a lot of weight. I went to my primary care physician, and due to absolutely idiotic rules with how medical coding worked, she couldn't actually feel it during my physical, so I had to make a second appointment for her to actually feel it. So she skipped straight to an MRI, saying that it's either a fibroid or it's a cyst. If I send you to an ultrasound, whoever you go to, they're just going to want an MRI anyway, so let's just do that. So she told me to get an MRI, and then she had a referral to the gynecologist within her network, who was the first one I saw. And then I got a recommendation from a coworker who had a friend who had a lot of problems and said this guy was really good, but he was the one who didn't want to do any of the surgery. All right, so once I had seen the third surgeon and we decided that we were going to do this, I started taking iron pills. I wound up using a specific brand called Blood Builder from Mega Food, and this is a very, very gentle iron pill. It also has vitamin C inside the pill, which makes it easier to absorb. It was really, really great. We wanted to make sure I could get my hemoglobin above 10 before surgery. I actually got mine to 13 with this over the course of about 5 months, so that's pretty good, I'd say. Although my ferritin is still pretty low, I took it from 4 to 8. Third gynecologist, he actually wanted me to get an iron infusion, but because of how weird the app and the patient records are, I actually missed that he had put in the order for it. Skipping ahead a bit, now that I've had this surgery, my primary care physician wants to keep doing the iron pills for 3 months and then stop for 3 months to see if I'm still having problems, and then we can revisit maybe the iron infusion. We'll see. Anyways, the other prep I did leading up to the surgery was making sure I was exercising a lot, going on walks, going on runs, and doing a lot of core workout. The night before, my surgeon had me drink a bottle of Ensure, and the morning of, about 3 hours before, he had me drink this thing called Clear Fast Pre-Op. Because you're fasting, you can't have anything to eat after midnight, but this was a clear liquid that has it has complex carbs, and there are about 200 calories in this bottle, and so that is part of this protocol called Enhanced Recovery After Surgery. And I went and read a lot of the literature behind it, and it's this idea that if you go into surgery in a fed state instead of a fasted state, it gives the body the ability to speed up recovery time by having calories that it can pull on. The other thing I did was the night before I showered with Heavy Cleanse, just that pink soap, and had a particular attention to the stomach area. So the morning of, my mom came with me. She had actually flown out about a day before to help me out, but she had forgotten her own meds, so she took my car and drove it home while I did all the pre-op stuff by myself, one of which I had to do a pregnancy test and wipe down with these chlorhexidine wipes, and there's 6 in the packet, and my nurse was fantastic. They had them in a wipe warmer and everything, and you do 1 per arm, 1 per leg, 1 for the front, and 1 for the back. You avoid your face and you avoid the genitals. And the idea behind that is you go into the OR with absolutely minimal germs. I was also on my period, so they gave me mesh undies and a pad to use, and they had me put all of my personal belongings and clothes that I came in with into a bag that basically stayed with me the entire time I was there, and then went into a locker. After I did the wipe down, they drew some more blood to see if I was anemic. I was not. And they did have to switch arms for my IV, but that's probably not normal. My right arm just wasn't behaving. They had me go to the bathroom again, and they walked the IV with me, and then they gave me the hat thing, because I have really long hair, and I think they do it even if you don't have very much hair. Afterwards, I met with the anesthesiologist, who asked me a lot of questions about how I react to anesthesia, and he made sure I got a scopolamine patch because I get very, very nauseous with anesthesia. And one of the things he asked me is at the end of all of them, he said, "Do you have any questions for me that I didn't ask you?" And I'm like, nope. I know I have a lot of nausea with anesthesia. I've had several surgeries in my life because of neurofibromatosis, which is something I can make a different video on if anyone is curious about it. It's a genetic nerve condition that causes nerve tumors to grow. Anyways, the surgeon also came in. He reviewed the blood work, asked if I had any questions, and again, because I have NF and he wasn't familiar with it, he had some questions about what to do with the NF tumors I have on my stomach, and he was like, "Can I go through them?" And I'm like, "No, they're tumors. If you're not going to remove them, just go around them. They're not like skin. You just can't, go through it. It would be very painful." Anyways, so after he was like, "Okay, cool, we're good," he left, and then the nurse was like, "I'm going to give you some Valium." And she also gave me something. She said that this is going to affect your short-term memory. You might not even remember going into the OR. Also, about that time, a resident came in. She introduced herself. There was someone else with her, but that person did not introduce who they were. I have no idea who they were. Maybe they were a med student or maybe another resident. Or she just said that she was just another set of hands to help out, and I'm like, cool. Shortly after that, I was moved to the OR, and I basically remember moving onto the table and staring up at like the lights, and that's it. I don't remember anything after that. After surgery, I was pretty groggy. I was pretty nauseated, and I had this like weird pain down where like the uterus where the fibroid was, that I was like, it feels like something, I feel like a straight cut, which I think was just my brain pulling tricks on me. But they gave me pain meds and that went away. And at that point I ate some graham crackers, and after a little bit they took the oxygen off, like the oxygen tube off, and let me go to the bathroom. And then after about another hour they moved me to another room, and a different nurse came in who happened to be the nurse who helped me through all the pre-op stuff. And my mom was allowed to come back and be with me. So during this time, I would have these like moments where I'm like, cool, I'm fine, I'm great. And then moments of just wanting to go straight back to sleep. But I was able to get dressed, and the nurse showed me how to cough, which was leaning into the pillow, embracing yourself against the pillow and coughing. She also gave me a belly binder, but I didn't put it on because I got it as one of the last things I did before I left. And then she went over all the post-op instructions. And at this particular hospital, she was the one who helped me into the wheelchair and took me out to my car. So for the drive home, something that I would recommend, I have it here, is that you get something to put over your seatbelt. So a lot of people use like a hysterectomy pillow or something like that. I had this squishable that I was like, well, this is the right size, and I can just turn it upside down like this and have it go over here, and it can go over the seat belt and won't be that big of a deal. I got this a really long time ago, so I don't think they still make it, but if they, on the off chance they do, this is the grilled cheese squishable. I think I got it about 10 years ago. I would say that the drive home, anything that's really bumpy was pretty painful to go over. And the one thing I didn't have that upon reflection probably would have been really nice is a travel pillow so that you could prop your neck up, because like I said, I was still really groggy and just slept the whole drive, or tried to sleep the whole drive through. So when I got home, I went upstairs, my room's on the second floor, and tried to lay in bed. And I immediately felt sick, pushed myself off the bed, went to the bathroom, took care of that. And when I got back to my room, I just moved the wedge pillow that I had bought, put it on that, and just laid on that, and it was so much better. So what I think happened is that it was just a reaction to the gas pain. As soon as I laid down, the gas pain shot up into my neck arm area right here, and just was incredibly painful. So, but laying on the wedge pillow, none of that happened. And the other thing I did finally was I set my alarms on my phone for when I needed to be on the right cadence, and then I just went to sleep. So the next few days, I was really, really bloated, and I didn't take any pictures, and I thought about taking pictures of like the scar and how it looked, but I wound up not doing that. So what I was told, it's very important to keep up with your painkillers, take Gas-X. I switched from Tylenol to Aleve because Tylenol normally doesn't do anything for me, and I used the oxycodone that they gave me, but I tapered off of it so it wouldn't be a huge drop off when I did. I did this by cutting the pills in half. Partway through day 2, I started doing half pills and letting the Tylenol take over. The other thing I did was I set up a small little box with everything inside it that I need. Let me just show you that. I got this at Target a while back. Yeah, so this is my post-op instructions. I kept that by my side in here as well, because if I needed to call the doctor, I would have all that info right here. But basically this, I kept it on the side of my bed. It had everything in here that I need, but I thought wound up being very helpful. Here is the oxycodone, and then I have the Tylenol, Aleve, stool softeners, the Gas-X. This is just a generic of it, and has everything in it that I needed to get to, so I wouldn't need to move. And I had like water bottles in here as well at one point. And hi cat. I actually can't pick my cat up, he weighs too much. So yeah, so something like that, super, super helpful. The other thing I had was extension cords, a couple of extension cords for like my phone, for my iPad, my computer, just so I wouldn't have to like reach anywhere. I did mostly sleep for the first few days. The anesthesiologist called after a couple days to just follow up, see how I was doing. He told me I was very boring, which I was like, well, thank you. And gave me some tips for how to deal with the nausea that I was still having. He thought it was probably mostly related to the oxycodone that I was still taking. The tapering off of that was going to help with that. And not sure if it did, not sure if it didn't, but I had this scopolamine patch still. The surgeon also called me a few days later. I had slept through the call because my phone goes into do not disturb mode because normally I'm at work. So I had to take it off do not disturb, and he followed up the next day. And then I was able to ask him about a few things. I did take a shower at some point, but I covered the incisions with this wound dressing and then with cotton on top. This is what I did afterwards, so you can see it. I didn't actually need to do that. You don't have to if you don't want to, but I didn't want to get any of the incisions wet. The other thing I would do, starting the first day, I took some walks around the house. It didn't really hurt to lay on my side, so I just laid on the wedge pillow and slept on it, which for me, I'm a side sleeper. It was pretty rough. So it's day 8 now. I'm feeling good enough to make some short trips out of the house. I can drive. I'm still having some brain fog moments. I was having dinner with a friend and I looked at her and I was like, like the place where they cut you. And I'm like, I was trying to think of the word incision. And she just looked at me and she's like, oh, you have like mom brain, but you don't have a baby. And I'm like, thanks. But I will say it does hurt to sit too long if I'm not sitting up straight. And that's where like the binder comes in too, because it helps remind me to sit up straight. The first few days I was very hunched over like this because that put the least amount of pressure on the incisions, and having to remind myself to like stand up straight, and not like bend around them. I still need some painkillers, especially for the belly button incision. And that's just because that's where like the largest cut was. That's where they probably did a lot of the pulling on it. So I'm going to go ahead and like show what it looks like. So it's not too bad now. This was very, very bruised when I came out. And so there's 2 here. This is one NF tumor, and then 1 here, and then 1 here. So 5 in total. You can see that it's still like kind of bloated and pushed out. That's not normal for me. You can see that's still a little bruised here, and then the incision here. So some tips for those who are in the process of doing this: if you are working and you have FMLA access, because if that means like you're American, you have worked at your office, I think, for at least a year, and then you can apply for FMLA coverage, which means that they have to offer you your job back, because this can take 2 to 6 weeks to recover from. And so, but if you also, on top of that, need to put in your short-term disability work, you need to get all that in ASAP. It is a big pain in the butt. It took a lot of time trying to follow up on that. And some doctor offices will charge you to fill out the form for all of it. Mine didn't. I had to do a lot of follow-up and making sure that like all the paperwork was in the right place, because my company, short-term disability company that we work with to do it, has a terrible website, and like I had no idea what my doctor had submitted versus like what my company had submitted. But you do need to make sure that you do this at least 30 days in advance, because of all of the work that's necessary. HR will have to fill out work and say like what like your salary is and what your work duties are, so that can all go into their system. And then like the doctor has to fill out all these things with all the codes and how long it's going to take. So it takes a really long time. If you're in a state like I am with Colorado, we also have what's called FMLI. It's a very similar procedure, but in Colorado, you can't do it until you're 30 days out, and you can't pre-file too early like you can in some other cases. And, it's very similar. Like you have to put in like where your company is and what your normal work hours are. And so that's all very important to get done. One of the things I did that day was one of the only things I basically had enough mental cognition to was log in to both our FMLA and my FMLI and say, yes, I have started. And then that set all of that pieces in motion there. So the other thing I would recommend you do is get all your prep done, as in like have like the box set up with all the pills and other pieces you need, extension cords, the wedge pillow in place, and yeah. I actually was like, I'm not going to need a wedge pillow. I don't want to buy it. But I was walking through Costco a few days before, and I was like, you know what? It's right there. It's like $20 some. I'm just going to buy it. And I did, and it's fantastic. So I recommend it. So some things I would recommend that you buy that I have used is a wedge pillow, an oversized shirt to sleep in, And I didn't even bother with pants because it was painful to pull them up every time I went to the bathroom. So just get like an XXL t-shirt I use when I sleep in normally, and I thought that was great. Also, I would recommend that your hospital outfit, that you get it as loose as you want. So I just used like, not like a PJ set, but something that was just super, super comfy and bigger because you are going to be a little bit bloated. I would also recommend a belly binder if you don't have one or you're not given one. I found it useful. I know some ladies don't. I mostly sleep in it still or when I'm sitting, but I don't have it on all the time anymore. Another thing I would recommend is a pillow for the drive home. And also because, like I said, you're going to want to cough into it. And so let me just show kind of like what the nurse said. You're going to like brace yourself against it and lean into it and cough. The other thing I did was, if I didn't have the pillow nearby and like I was on my bed, is I would just kind of, how to put it, like crisscross applesauce and just like bending over and coughing. I found that helped a lot too. Other things I'd recommend are Gas-X, a stool softener. Dramamine I felt was very, very helpful, especially after the scopolamine patch wore off and I didn't have any Zorfran or any other type of anti-nausea thing. I got this from Costco, which was 100 pills. It's chewable. This is actually meclizine, which is the non-drowsy Dramamine, and this was like $3.60, which is super cheap. So if you have access to Costco, they do sell it. Other things I would recommend are soups and some snacks so nearby that you can have. Coffee was something that my doctor recommended to help with, get things moving again as well. He also said chewing gum helps a lot too with getting the gas. I also bought a heating pad, and I felt it very helpful to be on my back to help with gas pain. I was told I could use it over the incisions, but to limit it to 20 minutes so that I didn't melt the adhesive, like the Dermabond that they used on it. I also have a knockoff squatty potty that I picked up at Target. Something to help you stand up without using your core. So you're going to be doing a lot of like pulling or pushing with your arms to try and avoid using your core because it's going to hurt a lot. And like I said, like a plastic storage box. Some of the things we brought were canned coffee. For the coffee, it's the cold brew coffee just in a can. I could put it in the fridge. The shelf stable milk boxes I could put in the fridge and just not have to worry about that, because you're going to be on a lifting restriction. At least I am. I'm not allowed to lift anything greater than 10 pounds, which is why I can't pick up my cat. He is 13 pounds because he's a big boy. The last thing I'd recommend is that you look up videos on how to get out of bed without using your core. And so this is going to be a lot of rolling and using your arm muscles to push up. A lot of it's all over the internet, so find one. It's fantastic. And yeah, so hopefully this was super helpful. Good luck if you are having surgery soon.